He didn't just build hospitals, he built an empire in the one place no one thought to look. In the heart of America, a young doctor saw a system collapsing under inefficiency, high costs, and outdated management. While others focused on treating patients, he focused on treating the system itself. He grew up believing healthcare wasn't just a service, it was a sacred duty. But he also believed something no one else dared to say out loud. To save more lives, medicine needed the scale, discipline, and precision of a modern corporation. And from that radical idea, he forged something America had never seen before, a private hospital empire. Created in an era ruled by regulation and tradition, powered by ambition, and scaled at a speed that left competitors breathless. He didn't open another clinic. He founded HCA Healthcare. From a single family-run hospital to the largest private operator in the United States, Frist became a billionaire in an industry where most struggled to even break. Behind the shiny corridors and cutting-edge equipment were federal raids, whistleblowers, secret investigations, and a record-breaking $14.6 billion fine, the largest healthcare fraud case in US history. The doctor who once swore not to harm found his legacy surrounded by accusations of putting profits over patients. So the question remains, did this man truly revolutionize American healthcare, making it faster, more efficient, and capable of saving countless lives? Or did he transform human suffering into a business empire, proving that in America, even healing can be built for the bottom line? This is the story of Thomas Frist Jr. To understand how a doctor could turn healing into an empire, we have to go back to where it all began. Thomas Frist Jr. was born in 1938 in Nashville, Tennessee, into a house where medicine was not just work, it was identity. His father, Dr. Thomas Frist Sr., was the classic American physician, respected, always on call, moving from one patient to the next, with quiet seriousness. For young Thomas, hospitals were not distant institutions. They were the background of his childhood. He watched his father race through emergencies, listened to dinner table stories of crises narrowly avoided, and absorbed one core belief: healthcare is a sacred duty. He followed the script perfectly. Medical school, training, served as a US Air Force flight surgeon. By every external measure, Thomas Frist Jr. was on track to become exactly what his father was, a good, respectable doctor in a respected community. Hospitals weren't just places of compassion. They were also places of chaos. Overcrowded wards, confused administration, financial instability, systems so inefficient that doctors spent more time fighting paperwork and bureaucracy than treating patients. He began to believe something almost heretical for that era. Hospitals didn't only need better doctors, they needed better management. He saw that a hospital could collapse not because of bad medicine, but because of bad business. And if business could break a hospital, maybe business could also save it. In 1968, his father opened a small hospital in Nashville. On paper, it was just another local facility. But for Thomas Frist Jr., it was something else, a test case. Standing in that building, he asked the question that would define the rest of his life. What if we ran hospitals the way we run serious corporations? Not as charities stumbling from crisis to crisis, but as disciplined, systematized organizations. Most people would have stopped at the question. Frist didn't. From that single hospital, he began sketching out something no one had really tried before in America. A for-profit hospital network, standardized, centralized, and built to grow. He believed that if he could bring corporate discipline into the heart of healthcare, he could save more lives, treat more people, and keep hospitals financially stable instead of constantly on the edge of closure. That model would soon get a name: Hospital Corporation of America, HCA. And from there, the experiment would stop being an idea and start becoming an empire. Once HCA existed on paper, Frist's idea met the real world. The founding strategy was simple to describe, but ruthless in execution. Find struggling hospitals across America, acquire them, modernize them, make them profitable. Repeat. Where most people saw failing facilities, Frist saw raw material. Community hospitals that were bleeding money, unable to invest in new equipment, or on the brink of closure, were pulled into HCA's orbit. Standardized protocols meant a patient in Texas could receive care guided by the same playbook as a patient in Florida. Centralized purchasing meant HCA could buy equipment cheaper than any independent hospital. A shared management structure meant executives could study what worked in one region and copy it across dozens of others. Doctors, in theory, were freed to focus on medicine. The results were hard to argue with. Beds filled, revenues grew, more hospitals wanted in. Through the 1970s and 1980s, HCA expanded at a pace no one in healthcare had seen before. The company went public, raising capital from Wall Street. It went private, restructured, then went public again. One hospital became dozens, dozens became hundreds. By the 1980s, HCA controlled more than 400 hospitals. Eventually, the empire would stretch to over 2,000 care sites, hospitals, surgery centers, urgent care clinics, freestanding ERS. At its peak, the company would generate over $60 billion a year in revenue. This was the billion-dollar machine, a system that took something people once saw as local, fragile, and charity-adjacent, and transformed it into a national, scalable, highly profitable business. But machines that grow this fast always come with pressure. Pressure to hit numbers, pressure to keep margins up, pressure to make every hospital in the network perform. Inside HCA, that pressure translated into systems, coding practices, billing rules, contracts, and internal targets. For years, it stayed invisible to the public. The empire looked clean from the outside: advanced facilities, modern equipment, stable finances. Until people inside the machine started to talk. Until the government started to listen. And suddenly, the model that had made Frist a billionaire was no longer just admired. It was under investigation. Federal agents walked into HCA facilities across multiple states. They seized boxes of documents, subpoenas followed, investigators examined billing records line by line, claim by claim. The allegations were massive: overbilling Medicare and Medicaid, improper payments and incentives, a system that, according to prosecutors, had turned the complexity of healthcare billing into a profit machine at the expense of taxpayers. $95 million to resolve criminal charges, over $840 million in civil penalties. Additional settlements pushing the total past $1.7 billion at the time, the largest healthcare fraud case in US history. By the time the raids happened, Thomas Frist Jr. had already stepped back from HCA's day-to-day operations. Other executives were running the machine. He was still a major shareholder, still a dominant figure in the background, but no longer the one signing off on every decision. HCA paid the fines, restructured operations, and began a long, careful rebuild of its public image. While the corporate entity took the damage, Frist himself remained almost untouched. He was never charged. He never became the public face of the scandal. He stayed what he had always been in public life: quiet. Billions earned from hospitals began flowing into philanthropy, medical research, universities, community health programs. He was now a paradox in human form, a doctor whose company paid one of the largest fraud fines in medical history, but who also funded programs that genuinely expanded access to care. A billionaire who reshaped healthcare in ways critics called dangerous. Critics saw a businessman who proved how far you can push a system when profit is the engine, not the byproduct. Both sides agreed on one thing: he had changed American healthcare forever. By 2020, HCA was no longer an experiment. It was infrastructure. Then the world shut down. COVID-19 hit, and every weakness in global healthcare was exposed. Emergency rooms overflowed, doctors and nurses burned out, ventilators, oxygen, and ICU beds became headlines. The company could reroute staff between cities. It could leverage massive supply contracts when smaller hospitals were begging for basic protective gear. It could turn entire floors, even entire buildings, into COVID wards in a matter of days. To Frist's supporters, the pandemic looked like proof of concept. But the criticism didn't disappear, it evolved. Reports and debates surfaced about staffing levels, hazard pay, how much of the burden frontline workers carried versus how much reward executives received. The old question resurfaced with fresh urgency. From 2021 to 2024, while the world tried to recover, HCA kept expanding. But expansion brought new vulnerabilities. In July 2023, HCA faced another crisis, a massive data breach that potentially exposed the personal information of 11 million patients. Medical records, email addresses, phone numbers, patient service dates, all compromised in what became one of the largest healthcare data breaches in American history. The stolen data reportedly appeared on online forums, offered for sale to the highest bidder. The breach reignited old debates. When a single company controls sensitive data on millions of Americans, what happens when that security fails? And in a system designed for profit and scale, is patient privacy just another cost center that gets underinvested? By 2025, HCA wasn't just a hospital chain. It was one of the primary blueprints for how modern healthcare could be run. Consolidated, data-driven, staffed by hundreds of thousands of people, and deeply entangled with government programs and private insurers. The story of Thomas Frist Jr. is not the story of a doctor or a businessman alone. It is the story of a man who saw a broken system and rebuilt it his way. From a single hospital to a $175 billion empire, he changed American healthcare more than any politician or reformer of his time. Some say he saved the system, others say he monetized it. Both may be right, both may be wrong. But one truth is undeniable: you cannot understand American healthcare without understanding Thomas Frist Jr. So now the question is yours. Did he revolutionize American healthcare? Or did he turn it into a business empire built on human need?